call this meeting of the Central Nevada Health District to order. If we'd all stand and pledge allegiance to the flag.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Has the agenda been posted in compliance with NRS?
Yes. Amber Edwards, for the record, verifies that the agenda for this meeting was posted on the 17th day of April, 2025, between the hours of 12 p.m. and 3 p.m. at all the locations listed on the agenda.
Amber, could you take roll, please?
Yes. Chair Ken Tedford,
Here.
County Manager Jim Barbie,
Present.
Justin Heath,
Here.
Bob Erickson,
Here.
Denise Ferguson, Don Witten. Here. Connie Gottschalk, Jeb Rowley, Rich McKay, Brandon Chaddick, Tony Roos.
Here.
Amber, is that a quorum of the board?
Yes.
Being a quorum of the board, we'll go to item 5, public comment, which will just be general in nature, not relevant to any item on the agenda today. Discussion can be held, but no decision could be made. Is there any public comment? Being no public comment, we'll go to item 6, consideration and action of approval of the minutes of the meeting held on February 13th, 2025. Are there any corrections or additions to those minutes? And if not, I'd entertain a motion to approve.
Mr. Mayor, I make a motion to approve the minutes of the meeting held on February 13th, 2025.
Do we have a second?
Second.
We have a motion and a second. All in favor?
Aye.
Aye.
Any opposed? None opposed? Motion carries, and the minutes of February 13th have been approved. We'll go to item 7, which is tabled for this meeting, which moves us to item 8, consideration and possible action of ratification of the appointment of Shannon Ernst as the interim administrator for the Central Nevada Health District by the Board of Health Chair, effective March 28, 2025. That's my appointment of Shannon as chair through March 28, 2025, and I need the board to ratify that appointment.
Mr. Chairman, Jim Barbie for the record. We appreciate Shannon being willing to step up and mind the gap, as it were, for us a little bit here. And I would wholeheartedly move to confirm her as our interim director.
Do we have a second to that?
Dawn Witten, for the record, I second that motion.
We have a motion and a second. All in favor?
Aye.
None opposed? Motion carries, and thank you, Shannon, for helping us out. I really appreciate it. You don't know how much I appreciate it. We'll go to item 9, the legislative agenda. Anything you'd like to go through, Shannon or Jeff?
I'm sorry, I was asking a question of Amber real quick. Shannon has asked that I take a few moments here and just kind of go over the current status of the legislature bills that affect the health district. As members of the board are aware, we haven't had a meeting since, I think, February, and the legislature has not stopped just because we haven't had some meetings. So things have been plugging forward, and the position to oppose or support a particular bill, that authority generally rests with the board. And so as there have not been board meetings, my understanding is staff has made some decisions and supported or opposed certain bills. So I'm going to go over some of those I believe we'll be requesting some motions throughout to either ratify certain actions taken by staff to support or oppose a bill, or if there's action that has not been taken by staff to either support or oppose certain bills. And so I'll go through each one. I'll try to keep it at a bird's eye view, because many of these are, 30, 40-page bills, and there's a lot of information in there that I'm not going to recall off the top of my head. And so I'll try to keep them at a high level and answer questions if there are any as they come. And I believe, was there included in the packet the
I think
the legislative spreadsheet? Was it in there? Okay.
Yes.
SB 29 revises provisions relating to Medicaid. As best I could tell this morning, looking at the legislative website, that essentially died in committee and no further action is allowed on that particular bill. So we'll just move past that one. SB 43, staff on March 27th testified in support of this bill. Generally, what this does is that it relates to solid waste management and public water systems. As it currently sits, those are kind of federally mandated oversight that goes through the state to the district as the law is currently written. It is a mandate that those services go to, the drinking water services go to the district, whereas it is optional if solid waste goes to the district. And so as the district was being formed, I think it was clear that it was not ready to take on those responsibilities in and of itself. And so there have been interlocal contracts entered with the state to oversee those. And so what this bill does is it, instead of allowing the state to oversee what's being done by the district and come in and say, what you're doing is inadequate, we want to take over, is it shifts that to before the district takes over. It says we are going to, as a state, put together some regulations saying what you need to do in order to demonstrate capability to take over these systems. And then once you do that, you can take it over, and then there's still oversight. So essentially, it's the district doesn't take it and then potentially have it taken away. The state will see if people are ready, give it to the district, and then oversee it and potentially take it back if there's a lack of capability going forward. So that's what this was. It's, again, staff testified in support of this, and so today I believe there will be a request to ratify that testimony and support.
Mr. Chairman, I would move to support SB 43.
We have a motion to support SB 43 from Jim. Do we have a second?
Mr. Chairman, I'll second the motion.
We have a second. All in favor?
Aye.
Aye.
None opposed? Motion carries. And
Thank you. Moving on to
you have
SB.
that. You
Oh.
have that okay to do that.
Perfect. Yep, that's perfect. And then we'll just move on to the next one if you're okay with that.
You bet.
SB 295 is provisions relating to food establishments. These primarily affect those counties with over 100,000 population. However, there are some removal of, barriers for what we have to do. In other words, relating to sidewalk vendors, food vendors, this is a bill that's trying to make it essentially easier for them to do their jobs and to work with boards of health. Originally in this bill, there was a task force that was supposed to be created. It seemed like quite a burden. And that task force would advise boards on what needed to be done regarding outreach and things like that. That's been amended out of it. However, again, this will mostly impact those over 100,000. Previous Administrator Darren Winkleman testified in opposition to this on March 6th. And so today I believe there's a request to have a motion to ratify that testimony in opposition regarding this bill.
Tell me a little bit about the sidewalk vendors. There was some legislation that primarily dealt with Las Vegas and sidewalk vendors. Do you remember in the last couple of sessions?
Yes, I'm not familiar with the last few sessions regarding this, but again, yes, I think this is something that comes out of those larger areas like Las Vegas where they want to make a more congenial relationship between, as I read it, between sidewalk vendors and the health districts, have information more readily available to the sidewalk vendors so that they can access it easier. There's some requirements in this to post certain things online, things of that nature to make that information accessible Again, a lot of this was slashed out in the amendment, but again, there was a lot of required outreach that was going to happen by the health districts to, again, create these task forces to reach out and contact and educate some of these food vendors to make that process a little more easy. And so there was going to be quite a burden on some of those, especially in the 100,000 plus jurisdictions. Regarding the smaller jurisdictions like the Central Nevada Health District, there may be a requirement that we have to adopt regulations regarding food vendors, but these larger outreach, things like that are only for the 100,000 population jurisdictions.
So does it add anything that we have to do?
As I read, again, this is one of those lengthy bills. There's a section where there had previously been regulations needed to be adopted by districts that have counties with over 100,000
Just over
population.
100,000.
By over 100,000. It appears that that language has been moved just regarding having the regulations. And so the district may need to adopt regulations regarding food vendors. I'm not sure if we have them yet. It's been a few years since we adopted those, and I haven't, dove into the food vendor aspect of it. And so, but we may need to adopt regulations regarding food vendors, which I don't think would be the end of the world. It could be done, but
Would this be separate, different than like the food trucks?
These are those food carts.
yeah, these
Right,
I
these
think
are the
these are more
carts,
of a food cart. And let me see if I wrote the definition down here, just so we're talking apples to apples.
Well, I know Farmers
Sidewalk
Markets has
vendors-
its own statute.
It says means a person who sells food upon a public sidewalk or other pedestrian path from a conveyance, a push cart, stand, display, pedal-driven cart, wagon, showcase, or rack. The term includes a non-stationary sidewalk vendor and a stationary sidewalk vendor. So not necessarily a food truck necessarily, but you're more in the path of where people are walking back and forth and things of that nature.
See, when Las Vegas ran into these food cart things, they did it in a certain section. They confined it to a couple of blocks, is what they confined it to. And that's where they got down into the legislation within the city, not not the legislature.
Yeah.
The city ordinance. And what we run into is like the food cart, the food carts. Like they're not owned by the people who have the carts. I mean, we can't even get a business license from these folks. I don't even know what we're doing with them because they're owned by somebody out of Reno or Sparks, and they drop the carts off, and then they're gone, and then the people here, there's a language issue sometimes, and so, and we don't want to stop them because, people like to go to them, and so we don't want to be high-handed and hard with them. But we're not talking to the owners of the carts. We're just talking to the people who are running the cart for the day, and it could be somebody else tomorrow. So I don't know how, if we ever got to what we're doing, who are we talking to? The Central Nevada Health District, when we show up, because it's a ghost who owns them.
Yeah.
So we've never regulated them, we've never given them a business license, we're not getting $50 for a business license from these folks that have the carts all over town.
Yeah. And so I was not involved in the discussion regarding the initial opposition. Again, that was made by the previous administrator. That testimony was given. Of note, the Southern Nevada Health District also opposed this at that time. But again, today is to whether to ratify that opposition or do otherwise.
We could remain neutral.
Yeah, the board could remain neutral on it.
Do you guys have any thoughts?
Do you have any, Shannon?
For the record, Shannon Ernst. Through conversation with the team, really, I don't think anybody opposes or has an opinion on this. We're not quite sure actually why the previous administrator went and opposed it. I think it's kind of when the health districts come together. You have the larger ones that talk to you and you kind of stand united through our association. So we will take the direction that the board desires. I don't think we have an opinion either way, and we'll follow the direction we get.
Mr. Chairman, I would move that we remain neutral on SB 295.
I
For
would
the
second.
record,
We have a motion, and I hear a second from Don.
yes.
All in favor?
Aye.
Opposed? None opposed? Motion carries to stay neutral on SB 295. Got that, Jeff?
Thank you. Yes, that'll do.
Okay.
SB 423, this is a bill revising provisions governing public health, and essentially this provides some funding for the health districts throughout the state. It's undergone some amendments, and it is currently, it made it through committee, but it was re-referred to the Committee on Finance with an exception regarding the timeline, and so this is not an insignificant amount of money. Essentially, this creates, and one of the amendments it did create, or what was created in an amendment, was that the Tribal Health Advisory Council was created. I think there appears to be an outreach to try to include the tribes within this discussion and funding of health districts. But that it creates the account for public health, and the state general fund requires a division of public and behavioral health, Department of Health and Human Services to administer the account. And it's been amended down from a 30 million number, but it requires the state treasurer to deposit the first $4,925,000 of revenues collected from certain taxes into that account each biennium, and then to essentially dole that out to the different health districts and counties to assist in promoting and protecting the public health. Interim Administrator Shannon Ernst provided a fiscal note and is requesting a motion to support and authorize staff to testify as such regarding this bill.
And this is 423?
That's correct.
Okay, questions of Jeff or a motion?
Mr. Chairman, I would move that we support and authorize the staff to testify on Bill number 423.
Second.
We have a motion and a second. All in favor?
Aye.
Aye.
None opposed? Motion carries, and we will support SB 423. Next one?
AB 40 revises various provisions relating to environmental hazards. Staff has, as I understand it, has staffed this and recommended taking a neutral position on it. As of this morning, it appears that this passed the Assembly a 41-1 vote. But existing law requires a solid waste management authority to issue permits to operate disposal sites. This bill requires a solid waste management authority to also issue permits to operate solid waste management facilities. The bill also requires State Environmental Commission to adopt regulations concerning standards for the issuance, renewal, modification, suspension, revocation, and denial of, and for the imposition of terms and conditions for a permit to construct and operate a solid waste management facility. There's a number of other provisions in there, if I'm remembering right, even regarding mining, but to place liens on certain property to recover costs and failure to pay dues on certain things. But again, this passed 41-1, and staff is recommending a neutral position on this.
No objection, Mr. Chairman. Do you think we want to go ahead and talk about AB 102, and then we can potentially knock two out in one motion?
Sure.
Was that a request to move to 102? Okay, 102, revision or revised provision relating to emergency medical services. This is particularly pertaining to Washoe County. District boards of health and health districts that include a county whose population 100,000 or more, but less than 700,000 may, by this bill, by affirmative vote of a majority of the members, elect to regulate emergency medical services. It's my understanding that Clark County already does this. This is an attempt to get Washoe into that same vein if they so choose. It doesn't appear to affect us, as it doesn't provide any authority or take any way regarding these medical services. And again, the recommendation is that the health district remain neutral, and no action's been taken up to this point.
Mr. Chairman, Jim Barbie for the record. I would move to stay neutral on AB 40 and AB 102.
For the record, Dawn Witten, I second that motion.
We have a motion to stay neutral on AB 40 and AB 102. We have a second. All in favor?
Aye.
Aye.
Any opposed? None opposed, motion carries to stay neutral on AB 40 and AB 102.
All right, moving on to AB 352, this is revises provisions relating to businesses, particularly cottage food and cottage cosmetic businesses, essentially. And staff may be able to provide more than I can on the definition of these, but those things that are essentially made within the home and are exempt from certain regulations. Staff testified in opposition of this. I'll note that the Washoe County Health District, which is now the Northern Nevada Public Health, also testified in opposition. Again, I didn't talk with Mr. Winkleman on this, but my understanding is that the basis for the opposition was there appeared to be a transition of power regulation of approval from local boards to the state, in that there would be essentially an approval that would go through the state, but then some regulatory nature would remain with the local boards, and they would kind of bifurcate that and make that difficult. At least that's what I observed from watching the recordings from what our staff provided in opposition and what the Washoe County Health District provided in opposition. And so, again, that's my understanding of what the opposition was there. There's a request from staff to ratify that opposition.
Yeah, Jeff, this is Dr. Heath, and yeah, I'm with you on this one. I think we should go against this bill.
Mr. Chairman, Jim Barbie for the record. I'm going to be the sticky one on this one. As a former director, Department of Agriculture, and was director during the time the cottage food process was created, I think back in the 15 session, somewhere in that timeline. They all kind of run together over those 7 years. The point was of that, and the spirit of that initial process was to lessen the regulatory requirements in these small cottage food opportunities, of which Churchill County is a significant one and has been for many, many years. And I'm giving you my opinion, then at that point, that was moved forward. The State Health District, which this relied on the State Health District up until just recently, and obviously with the formation of the Central Nevada Health District, so I kind of pushed back a little bit on the local versus state. The health districts basically came in, and there was kind of a continuation of the same old thing, and there was not, and there was the feel from a lot of the cottage industry folks, there was not a feel of a relief in regulatory requirements, and many were being held in some cases to the same kind of bar, or that was the feel they have in terms of a commercial kitchen, even though they're working outside of that. This is not a fee collection for Central Nevada Health District. It is part of the law is that it is waived. This was born in Department of Agriculture and their direct correspondence and connection with those small farm cottage food kind of producers. And I would be here today to debate and stand in favor of AB 352.
Jeff, this is Dr. Heath again for the record. But when they consider cosmetic, it looks here like it's like oils, bath preparations, perfumes, shampoos, body soaps. So there's a lot in that bill.
Which I think a lot of that already falls under the Department of Agriculture's authority.
Right. What would it do though with like the farmer markets and things? Do they all have to go get a license now from the Ag Department?
They already have to get a license as it stands now with the Ag Department through the, what do we call that? Now you're really going to press me from my back memory. Basically, this would put it all in one bucket, so they're only having to deal with one entity and not multiple entities. So ultimately, it will streamline, because they're already having to register for the, not vendors. It's a word, I'm sorry, Justin, I can't think of it.
That's okay.
What it's, but there is a license requirement for them at Department
But
of Ag as well.
they're already supposed to get a license?
Correct.
Okay.
Thank you. Thank you. It's a producer's permit, which also then does an online thing with Department of Ag and so on and so forth. And I believe it's a non-fee as well there. But that, the other component in this is Department of Health, State Department of Health is moving some of their programs currently through the executive budget action and a proposal by Governor Lombardo over to Department of Ag as well, to basically help offset the workload for this specific bill. And so I think they're gaining an additional 12 staff. So where we got plenty on our plate with Central Nevada Health District, and this is a direct tie to kind of the community that works through farmers markets and all those kind of things, the Department of Ag. To me, it makes sense to go ahead and support this bill.
For the record, Connie Gottschalk, I just have a question. So would this eliminate all of those other requirements, that licensing, or is this an addition to?
No, this would move the licensing, not eliminate it. So they wouldn't come to the health district, they would go directly to Department of Ag, which they're already headed to for the other stuff.
You got
Okay, I'm just making sure that it's not adding a layer. So instead of going to the Department of Health, it would go straight to Department of Ag, and then there would be no other requirements. I just want to make sure that we're not adding a layer to these people who are trying to start small businesses at home.
That's my understanding, correct? This would streamline that.
Okay, thank you.
Connie, is that you or Denise?
That was Connie.
Connie, okay, thank you. We'll add you to the meeting. Okay, but any other discussion? Dr. McDonald?
Mr. Chairman. In this process, Mr. Chairman, Ted McDonald for the record. In this process, who is this extra 12 staff coming on? Are they the inspectors, the regulatory? Who's responsible for the local evaluation and taking care of the inspections?
That would be Department of Agriculture, and yeah, these inspectors would add to that. And from luckily, have this background, right? So the Department of Agriculture has an office in Reno, in Elko, and in Las Vegas. So that gives them basically 3 offices where staff are located that would do the inspections.
Any other questions? If not, I'll entertain a motion to either approve or oppose.
For the
Or stay neutral.
For the record, Jim Barbie, County Manager, I would move to support AB 352.
For the record, Don Witten, I second that motion.
We have a motion and a second to support AB 352. All in favor?
Aye.
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 Opposed? Motion carries to support AB 352.
Lastly, and I think County Manager Barbie, this is probably the one you were referring to. This is BDR 51-1121. This is moving the regulation of food establishments, cottage food operations, and farm to fork events from the Division of Public and Behavioral Health to the Department of Agriculture. And so
That's
what this
correct.
bill does. The recommendation was that it remain neutral, although based on County Manager Barbie's previous comments, there may be some discussion on that.
This is Dr. Heath for the record. So Jim, this is going to streamline the approval process, you think?
Yeah, correct, because they're not going to have multiple agencies or entities that they're going to.
And it's not going to be like the DMV where you got to go wait for a long period of time, or?
Nope, if you've ever been to the Nevada Department of Agriculture, there are no lines, that's for sure.
Okay. Good.
Nothing could be like DMV, Justin. That's where they need to add the 12 jobs.
Right.
Well, based on the previous conversation, if no one else will jump out there, I'll go ahead and make a motion to support. And right, this is BDR 51-1121, correct?
That's correct.
So moved.
I'll second.
We have a motion and a second to support BDR 51-1121. All in favor?
Aye.
Opposed? None opposed, motion carries. And the direction is to support BDR 51-1121.
Mr. Chair, did we miss one?
You're talking about SB
29.
29. I covered that right at the very beginning.
Oh, sorry.
It did not make it out of committee, and
Oh.
so no further action is allowed. So, and that concludes the legislative presentation.
Yeah, that's the one that was killed, right? Okay, so that's the end of 9 and 9A. So we'll go to agenda item 10, consideration and possible action concerning approval of the notice of subaward between Community and Provider Outreach and Engagement Unit and Central Nevada Health District for electronic health record implementation per the approval of Assembly Bill 7, AB 7, in the amount of $36,572 upon approval through June 30th, 2025. Shannon?
Shannon Ernst for the record. So Central Nevada Health District was awarded the total of $36,572 as part of that bill, AB 7. Really, the goal of that is to make sure that you have a good working EMR system within your clinical to manage your records. It was back, and there is an error, I apologize, and it said in the report, will be implemented in 2022. Actually, we had a system that was implemented in 2022, which is the CDP. And so I've been working with the team to really evaluate this. When we implemented that system back in 2022, it cost us close to $200,000. There are items that are not working for the district at this time, and we had one meeting yesterday, we have another meeting tomorrow to see how do we make the system we have in play actually work for our district. Because really, to purchase a new system before June 30th of this year is not feasible, and I don't believe this would be sufficient funding to cover that. So we're going to work with them, but today it's just ratifying the approval to obtain these funds. For if any reason we just decide not to proceed in using these funds, we would return them back to the state and we would notify you. If we find that there's going to be some changes that we need to do to our CDP system to bring it up to where the team finds it to be feasible and usable, we would go back to this funder and ask to modify not to a purchase, but to use for our current system. If there's any questions, I can answer, sir.
Okay, are there any questions for Shannon on this? Any questions from the public? If not, back to the board for a motion.
Mr. Chairman, I would move, there we go. Mr. Chairman, I move that we approve the subaward between the Community and Provider Outreach of Engagement Unit and the Central Nevada Health District for electronic health record implementation per the approval of Assembly Bill Number 7 in the amount of $36,572 upon approval through June 30th, 2025.
Do we have a second?
Jim Barbie, second.
We have a motion and a second. All in favor?
Aye.
Aye.
Opposed? None being opposed. That subaward has been approved. We'll go to item 11, consideration and possible action concerning the ratification of a letter of support submitted on March 28th, 2025 to the Appropriations Committee Community Projects Funding Request on behalf of Mount Grant Hospital's HVAC system. Shannon.
Again, for the record, Shannon Ernst. So prior to me coming into this role, the previous administrator provided a letter of support for the HVAC system at Mount Grant Hospital to be funded through the Congressional Community Project Fund. So I'm bringing this before you, so it is ratified on record that this has been provided.
Okay, any questions for Shannon? If not, I'd entertain a motion.
Brendan Chaddock, for the record, make the motion to ratify the letter of support submitted on March 28th, 2025 to the Appropriations Committee Community Projects Funding Request on behalf of Mount Grant General Hospital's HVAC system.
Okay, thank you, Brandon. We have a motion and we have a second from Don. Thank you. All in favor?
Aye.
Aye.
None opposed?
No.
None opposed? Motion carries. And that letter of support has been approved. We'll go
For
to
the
item-
record, Denise Ferguson, can I
Yeah,
just make
Denise.
a comment, Chair? Sorry, hopefully you guys can hear me. I apologize that I'm not there in person, but I just want to thank the Health District for the support of our project. Obviously, this is just a submission request and support, but hopefully it does go through. It will definitely assist us in the infrastructure of our hospital, and this is one of the only fundings that will allow for us to do that kind of infrastructure, because it's a $2.5 million request. So greatly appreciate the support. Thank you again.
You bet. Thank you, Denise. We'll go to item 12. Staff update.
For the record,
Shannon?
Shannon Ernst Churchill, I want to say Social Services, sorry, I'm at Central Nevada Health District today. So I have provided it before you, it was not included in the packet, really an interim administrator's report. And what I wanted to do is just highlight what we have been working on since March 28th up to today. Things are moving quickly within the organization. One of the biggest first things we went with was review of financial standings. We've been going through each one of the grants. We've been reviewing where they're spending at. How can we go back and do a ratification and modify scopes of work so we can fully utilize those funds by June 30th? This is a negotiation with each one of the agencies approving us to do this. As you know, if you work in the grant world, usually you're doing this in December, January, not the beginning or the end of April. So we have had great support to try to make that happen. And as we do this, that would move from some funds having to be paid from the general to our grant funding and getting those expended. Also, and I've noticed that I'm not going to go through each item because I don't want to bore you today, but we're looking at doing time allocation so we can maintain compliance. We've really been reviewing the service delivery and service numbers. How are we delivering services and what are those numbers coming in? This is a deep dive into each one of our mandated functions when you look at clinical services, infectious disease with epidemiology, environmental health, and public health preparedness. Versus what are we doing because we got funded and we really want to have it in our community. So this is a huge evaluation. We've started collecting this. It's going to take us some time to come up with those recommendations. We've been reviewing all of the locations, hours, the needs, and the gaps. One of my biggest goals is to go out and meet with each one of the team members at their location and talk to them. What are you doing? What does it look like here? How do you feel that, is there any concerns? We're evaluating, are they working within their scope of their job description? We have some that are found that are not working with those scopes. How do we need to change this so that we are in the correct capacity for each one of our employees? Also looking at safety concerns. I was out in Hawthorne, one person in there, somebody comes in, there is no camera system, there's no security systems. How can we bring that up to par? And actually, it was last night, I met with a security system that we're looking at putting at the annex building here, and they can do a wireless system, so it links all of our locations together so everyone can monitor each other, even when they're out in those rural areas. We're really looking to increase communication with the health board here. As you saw, we had to do some cleanup items today, but we want to make sure that this board is engaged in what the team is doing, has input on the different items that are being rolled out as we proceed. But also we want to look at the Board of County Commissioners and City Council. They are our partners. It was these 5 that put this health district together. We want to keep them engaged as we move forward. What changes? This from 2022 is really what we're doing. What we want to continue to do is each community still want what they wanted back when we did those initial assessments starting in 2021. And so I've kind of outlined where we will be going. I was at Mineral County Board of Commissioners last week. I learned quite a bit. I will be back there every month. The report that Dr. McDonald will be providing, they have requested we provide that to them also. And so that's where we want to make sure and get that out. A lot of this is going to be conversations of what do you want to see as we do go forward. Let's see. We are developing policies and procedures for staff. We found that these have been lacking over the last couple of years, just general office supplies, office policies, training, division procedures for routine processes. One of the things is nobody's doing anything quite the same. They're not quite sure what is the right way. So we're working with each division within Central Nevada Health District, develop what are the protocols, how do we follow this? A lot of them, we have environmental health regulations, you have epidemiology regulations, but those processes on how we actually approach something have not been developed. We're evaluating all the software, like I mentioned on that grant. How do we make the software that we paid so much money for that this board approved prior work for us now? If it's a tweak, and it was a great meeting yesterday, one of it's on billing. It was giving Shasta a horrible time just because she can't match up the Burning Man. They're like, we can tweak this report, so now it'll take her less time. So we're supposed to, within 2 weeks, be following up with more on that. We're looking at how administration was working prior to authorize for proper procurement. We found there's several contracts that are in work that had not gone out to bid. We'll be bringing those forward to the board with our recommendation to proceed in the future. We want to increase our community awareness as a whole. Many people don't know Central Nevada Health District is here. Why are they here? And what is the mission for them to be here? We have found some funding that allows us to put up some billboards. We got approved yesterday to modify the fund. So here in Churchill and in Pershing, we've found identified billboards. We cannot find one in Mineral. I would love to find one in Mineral. But it's really going to advertise what are we doing, and we want to do a lot more of that education. We have our epidemiologists looking at how do we do outreach in Mineral. Has kind of been a challenge with looking at hantavirus and the mice. We're looking at mailers and how much it'll cost to get those to the residents. And so hopefully that'll be happening within the next couple of weeks. And then last, we're developing the budget workshop for May 29th. I hope everyone can join us here in person at 10:30 in the morning, and we're going to try to be done by 2 p.m. in the afternoon. What that goal of that is really to look at the direction of Central Nevada Health District, understanding what our mandates are, statistics and who we're serving as we should continue to do those or we need to revise those, budget recommendations, and an overall organizational structure of options for staff and the overall organization. So that's what we've been working on since the 28th. It feels like it's been 3 months now, but it hasn't been that long. So if there's any questions, I'm happy to answer.
Does the board have any questions for Shannon?
For the record, Denise Ferguson from Mineral County. Shannon, I don't have any questions, but love the ideas and some of the things that you've identified in Mineral County. Definitely, if you need a resource for a billboard, I can send you something by email. We have been researching the need for that for the hospital and have found some resources that might benefit you.
Thank you. Really would appreciate it, Denise, and we will be sending you an email.
Okay, thank you.
Connie got struck for the record. Shannon, could you just repeat the date and time of that workshop, please?
May 29th, 10:30 to 2.
Thank you.
Correct, and please let us know if you have not received a calendar invite. Amber sent these out last week, and so if you're not receiving those, please do let us know, because I want to make sure that our email communication, putting things on your calendar, is working correctly and sending out these packets in advance to you.
Okay, we'll go to 12A, consideration and possible action concerning review and approval of the county level March 2025 data. That's Ted.
Ted McDonald, for the record. Thank you, Chair, for the opportunity to be here. So in your packets are the presentations from all the different counties with the numbers that have been presented through March. And with that, I've added my executive summary. The district has been very busy, especially in the areas of public emergency preparedness and the environmental services. And our epidemiologist is always busy trying to keep up with all the information that's coming to her from the state for reportable diseases and respiratory illnesses. So I appreciate their help in being able to prevent this. The staff themselves provide this into a file and put it in a form that is easy to read and presentable. So they deserve all the credit for this. Some of the highlights is that at this point, we do have a minimal amount of influenza, COVID. Recently, around Easter time, there was a flare-up of a gastrointestinal illness that went through the community. This is purely by conversations with the emergency department, doctors, and other community members. We don't have any absolute data on that at this point. The staff has sent out recently a lot of information regarding hantavirus. The reason for this is that this is the season when there are lots of issues with mice and cleaning up and eliminating them, and also some flare-ups in our counties with having an excess of this. And the danger of hantavirus is real, and the information out there is to prevent infection while allowing people to be able to clean their house. The University of Nevada had their outreach clinic in Churchill County this last weekend, and their next one will be in July. The University of Nevada outreach team comes out and provides services to Churchill County. They currently are also going to Lyon County. They have been in Pershing County, and my goal now that I am currently, the University of Nevada has provided me malpractice insurance to be able to separate this process from the the health district. So if we wish to go to Pershing County and move outside of our facility, I'll be covered in any county that we go to be able to supervise the students. The Fallon Rural Family Practice Residency Development Steering Committee has presented to the Fallon City Council and to the county commissioners, has reached a point where they're now have made a grant request to HRSA, Health Resources and Service Administration, for a $750,000 grant to initiate the residency program. This amount of money is designed to initiate the program, release the burden on any entities that are associated with it, so that there isn't a barrier to starting the program. There are, I believe, 15 awards this year, and our grant application process indicates that we have a good chance of receiving this grant. The next stage is for them to start developing teams on the committee to focus on areas of staffing, community needs. The goal for this whole process is to be able to set up a program where we have in northern and western Nevada and central Nevada more of a chance to service our students that have gone to medical school. They have a place to come back to, and then an opportunity to stay in this area. And I will open it up for questions.
Any questions of the board for Dr. McDonald? If not, we'll go to 12B. Shannon?
Again, for the record, Shannon Ernst. So today we'd like to give you an overview of kind of how the fiscal looks within Central Nevada Health District. And one of the biggest things that I think you've heard about is the DOGE going on with our funding, right? This is happening in every one of my areas that I'm working in, and it did impact Central Nevada Health District. It was found on March 24th that we had funding that was pulled back to the federal government. We were actually not notified until March 25th that our funding ended the day before. And we had two funds that were actually impacted. One was awarded on January 13th and was set to expire on June 30th of 2025. The total amount that was unspent was $142,000. This one we did receive notification that due to the court orders that came into place, they were able to extend and allow us to expend up till April 17th. So Shasta has done an amazing job to go back and expend as much as possible within that. And we'll be submitting that request for funds. We will still have a loss of funds. We could not spend the 154. The other fund was brought before, it was extra funds that actually were awarded to Central Nevada Health District about November. It did not get executed until March 24th. Due to the fact it was not executed until the day that DOGE took those funds back, those funds were unable to be expended. And that was a loss of $372,000. So we have been working diligently through this. How do we move what we're expending in the funds that were lost into other grants so that we try to not impact the general fund? If you go to, you already got the spreadsheet up. Thank you. So I would like to take and announce, this is Shasta Garrison. She is our grants and fiscal specialist, and so she has done an excellent job, I will say, with the oversight that she's received in managing these funds. And she's going to explain this spreadsheet that's up on the board for you.
Hello, Shasta Garrison for the record. So this is a spreadsheet that I created to keep track better of our expenses. The first column you see is the budget, and that's the budget that was created, last year for this fiscal year. Second column is the amounts that we've paid under each one of those accounts as of March 31st. The pending column is, so those are expenses that I've already listed in the other spreadsheet that have just not, that have been expended in April, but have not been reconciled yet. And then the expended, I think in parentheses it says comptroller. Sorry, it's kind of blurry. That's what's actually been, it's the paid plus the pending, so it's just the total of the two, so that I have an accurate look as of that day. The reallocated column, those are funds, because most of our grants get executed months after they actually start. So unfortunately, I am going to learn next week how to do journal entries and to move them into the correct accounts. Because up until I get those executed awards, I have to allocate those bills to, say, the general fund accounts, and then later, after the grants are executed, I move them to the grant. But on paper, they're still showing under the general fund account. So Louise from Social Services is actually going to sit with me next week and show me how to do journal entries to move those all into the correct account. So this will be a completely accurate picture of what money comes from where.
Shasta is doing amazing work, and this is part of the things that we're going through, is learning the proper government processes for fund balances, how we balance the fund part of getting grants. They tell us you're going to get them July 1, and you don't receive them until December, and there's a retro memo with it. And she's done a great job, and is going to make it easier work for us to clean this up, and she'll understands the future. One of the big things why we wanted to bring this for you today is I really think it's important that this board understands the financial standings of Central Nevada Health District. And we are doing a lot of cleanup to make sure that we can give you an accurate shot and give you a good projections when we come before you May 29th. If you go to the next sheet, this provides a list of every one of the grants that are currently within Central Nevada Health District if they have not expired within this fiscal year. We have noted showing those fund balances on the very right. This is what we need to watch. It's looking to make sure that that last column over there, we are at zeros when that expiration date happens. And so that's why we're working with every one of these funders here to make sure we do a modification to bring these down to the lowest amount. And I will say, every funder I've spoke to date is very supportive in helping us with this. A lot of them will not allow us to extend the grants, because that's the first question. Can we extend this for another year? And they say, no, some of them we've already extended a year, the funds are expiring, but they'll help us modify and get this done as quick as possible so that we can use the funds. And again, Shasta is doing a great job with all of those. I think she has a great relationship with the funders, and that has helped a great deal. And they're people we've worked with for years, and so they understand we're a new organization and we're coming together. But we want to make sure that this is brought forward to you every meeting, as long as the board approves that. So you see it each time moving forward. If there's any questions we can answer regarding these two sheets. Okay, if we can go to the next one, please. So I'm just bringing this forward so that you can see what Central Nevada Health District looks like as of today for the organizational chart. When you see everything in yellow, these are vacant positions. At this time, we have done a hold on hiring of any positions until we do a full analysis of who we're serving, how many we're serving, and the needs that we have. So I just want to make sure and keep this in front of you. This will be another talking point for our workshop May 29th. And with that, we'll take any questions.
Are there any questions for Shannon or Shasta?
Are these positions new, or have they had people in them before?
The majority of these positions have had someone placed there prior, and they have left due to another opportunity and things of that sort. And so with it, this is a good time to stop. Within social services, I call it the Etch-a-Sketch. Sometimes you got to write something down, shake it up, and let's try something else to make sure that we're meeting all the needs. So we're going to stop on hiring, and the 29th, we'll see where the board desires to move.
Okay, thank you.
Mr. Chair, we have requested a motion on this to make sure that this has been viewed so that we can show our funders that we are reviewing this with the board.
What do you want a motion on, the financial report or the organizational chart?
Correct, and we
or
just need it on that whole piece to show that you've
the
seen
whole
it. So we've
packet?
made a whole motion for you on here.
On the whole packet?
Yes, please.
Okay.
Thank you.
About a motion from someone on the
Mr.
whole, just on the whole packet?
Mr. Chairman, I would move to accept and approve the packet as provided for the meeting today.
We have a motion from Jim. Do we have a second?
For the record, Don Witten, I second that motion.
We have a second from Don. All in favor?
Aye.
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 Any opposed? None opposed, motion carries. We'll go to item 13.
For the record.
Consideration.
Sorry,
I
I
better
jumped
read-
ahead.
I better read it in the record. Consideration and possible action concerning ratification of a letter confirming support for the creation of rural residency program at Banner Church Community Hospital submitted to the University of Nevada, Reno School of Medicine by Dr. Ted McDonald.
So again, Shannon Ernst, so this is a letter that was provided. Dr. McDonald submitted this, a letter of support on behalf of the Central Nevada Health District. So we're bringing this before you to be ratified. And a question we do have, it's been said that there's not been a presentation to this board regarding this program. And I know County Manager Barbie and Chairman Tedford, they have seen this presentation to know what this program is about from City Council and the others. Would this board like to have a presentation so they understand? Okay, I'm seeing head nods of yes.
The
So,
plan is, I'm on that board too, besides seeing it as the mayor, and Bob has seen it as chief of staff, so there's three of us have seen it, but the plan is to bring that presentation here. I think just some miscommunication has kept it from coming here when they did their whirlwind presentations one week here. So I don't know how the board wants to do this. But this letter's already gone out, so.
yes, it has. Could we look at maybe in our June meeting, requesting a presentation to see if they could attend at that time?
Yeah,
So
I'm
the
sure-
board is brought up to date.
I'm sure Dr. McGahey would be glad to be here.
Thank you.
So, Mr. Chairman, do you want a motion of support of the letter that's already gone?
Yeah, I think it's already gone, so
Mr. Chairman.
this is a great program, so,
Yeah.
for all these, for all us rural, so.
For the record, Jim Barbie, I would move to ratify the letter that was sent on March 27th, 2025 by Dr. McDonald to Amy McGahey in support of the residency program.
Chairman Bob Erickson, I'll second that motion.
We have a motion and a second. All in favor?
Aye.
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 Any opposed? Thank you, and we'll I'll give you her contact, and then we'll get her here. Item 14, consideration and possible action concerning ratification of cancellation notice to P1 Finance, policy number 0100350016-04, Dr. McDonald's policy, malpractice policy in the amount of $12,892.96 per year, as it was found to be a duplicate of the Nevada pool policy currently held. Shannon.
For the record, Shannon Ernst. So it was the first week in April. The staff and I met, and it was brought to my attention that there was a policy that was purchased on behalf of Dr. McDonald for his malpractice. And there had been several conversations going back and forth for months to see if this was a duplicate. We do have a policy under Pool Pack that covers for as a health official. And so it was getting that definition, and I want to thank Mr. Weed, because he helped a great deal, and also E.H. Hirsch, as we dove into this as what a health official was. And based off the review, it was found that the duties that Dr. McDonald here, he does under the scope of a health official. So he is covered under that practice, under that policy. Anything outside of the duties overseeing the staff here, the infectious disease, epidemiology, that would not be covered. So we were able to cancel that policy, and Shasta is working diligently to see about getting the refund of the $4,000 we have already paid to come back, since it really wasn't bonded yet. So we will continue to work on that. We're hoping to recoup those funds, but that policy has been canceled. So I just need a ratification on that. I had moved to make it happen, so we didn't have to pay another premium.
Yeah, good luck with that refund. Okay, thank you. Any questions for Shannon on this policy? If not, I entertain a motion from the board.
Mr. Chairman, Jim Barbie for the record. I would move to ratify the cancellation of the policy.
Do I have a second?
Dawn Whitten, I second that motion.
We have a second. All in favor?
Aye.
Aye.
None opposed? Motion carries. And this cancellation of this policy will go forward. We'll go to item 15, public comment, general in nature, not relative to any item on the agenda today. Discussion can be held, but no decision could be made. Is there any public comment? Being no public comment, we'll go to item 16, adjournment. Nothing else, we stand adjourned. Thank you all for being here. Just one housekeeping thing. When you jump on after we start the meeting, you folks on the board, just tell us you're there, okay? So we can make sure Amber can make sure you're in the record.